Hi, I'm Pastor Emiliano Viamel.
And I'm Elder Shane Neal.
And we're the hosts of Hour of Power.
We are ready to pray for you and with you.
Prayer is the key that unlocks heaven's door. In Philippians 4, 6 and 7, God cautions us not to be anxious about anything.
Instead, in every situation, by prayer and petition, with thanksgiving, present your requests to God. And the peace of God, which transcends all understanding, will guard your hearts and your minds in Christ Jesus.
Join us every Thursday night at 6 p.m. on our Facebook and YouTube pages, as well as Channel 98 on Central Cable TV, to experience this peace that passeth all understanding. You can join our global prayer family by praying that God continues to lead and bless this ministry,
by becoming a faithful viewer and inviting your friends and family to like and share our programs,
with your kind donations as well as your generous financial contributions.
Contact us at 501-613-9351
or send us an email at atn@cbm.belizeunion.org.
We are located at 10 3/4 miles Northern Highway at the Tubal Trade and Vocational Institute. Thank you for being a part of the ATN ministry.
And we pray God's richest blessings upon you and your family.
All my life, I've been dealing with projects. I do a lot of research. Basically try to understand how different materials affect fires. It involves a lot of formulas and gathering data. I met this girl once in grad school, and we got to talk about all kinds of things, and also about God. It was great. I could share with her what I believed in. And then I got busy with my own research and realized I may have treated her like a project. Like, I kind of expected her to change herself. But people are so much more than projects. There's some kind of human connection to it. I think we're supposed to share our lives with those around us, but sometimes just being with them, being their friend, that's the best way to find true connection. And that's what witnessing is to me, relationships and friendships.
Hi, I'm Pastor Davis.
I'm Pastor Dennis McCullough.
We are the hosts of your Bible study series, Words of Wisdom. In 2 Timothy 3:16, God reminds us that all scripture is given by inspiration of God and is profitable for doctrine, for reproof,
for correction, and for instruction in righteousness.
Words of Wisdom is a specially designed program brought to you by ATN in an effort to share the Advent message to our friends and faithful viewers who are yearning to build a growing and saving relationship with Jesus Christ. If you want to learn more about our rich Adventist heritage, basic fundamental belief, counsel on courtship and marriage,
or simply a deeper study of God's written word, then join us Wednesday mornings at 10 a.m. on our Facebook and YouTube pages, as well as Channel 98 on Central TV. Join in and be a part of this special Bible studies effort by praying that God continues to lead and bless this ministry, by becoming a faithful viewer and inviting your friends and family to like and share our programs, by your kind donations and of course your generous financial contributions. Contact us at 416139351 or send us an email at atn@cbm.belizeunion.org. We are located at 10 3/4 miles Philip Golson Highway. Thank you for being a part of the ATN ministry. It is our prayer that you will keep the book of the law always on your lips.
meditate on it day and night, that thou mayest observe to do according to that which is written therein. then thou shalt make thy way prosperous and have good success.
Good morning, and thank you for joining us for another episode of Defining Your Health. I'm your host, Tracy Lewis. We want to thank our viewers for always, joining us on Facebook, on YouTube, those who watch us on channel 98. We ask that you continue to like our page, subscribe. We're always here with an interesting topic. And today is no exception. Mother's Day is coming up, and we want to talk about something related, health tips for labor and delivery. So we have Dr. Joshua Canul here with us this morning. He's a general practitioner, and he'll be sharing some insights about, tips for a healthy pregnancy and delivery. So Doc, can you share what it is that comes under your belt as a general practitioner?
Like she mentioned, I am Dr. Joshua Canul. I've been practicing medicine for 6 years now. I currently work in San Pedro Polyclinic. And along the way, we've done trainings for postpartum hemorrhage, resuscitation for neonates, and other trainings that the Ministry of Health does provide for medical officers and healthcare workers as well.
Right, so you do the full work, everything you handle.
Yes, because when you graduated or when you come back to Belize first as a medical practitioner, we have to do rotations mandatory in KHMH.
Okay.
And so you rotate through all the services. You've done that before, yes, in medical school, but when you come to Belize, in order for us to adapt to the healthcare system here, which is unique for our country, we rotate through the different services and we see how different cases are managed. And we get to work with the specialists, the midwives there, the other doctors and nurses as well.
Right. Well, we're excited to have you here on ATN, and I want to tap into your experience with babies. Babies are always cute and adorable, and so this is a loving topic this morning. So I'm excited, and one of the first things that come to mind when you think about babies, mothers. I'm not saying they're always caught off guard, but most of the time you ask your mom, like, Mom, what happened when you were planning to have me? Sometimes it's planned, sometimes it's not planned. But walk me through how to prepare for having a child.
I said that's important, but you just mentioned, you said prepare to have a child, not what do I do when I'm pregnant.
Right.
So when you're about to, or you're planning to have a child, which should be the cases, we should try to get our bodies in the optimum condition for us to be able to have this child and have a healthy child. So recommendation is to have children within childbearing age. So you know that anybody who is like 30, above the age of 35, would then begin to run into risk. So we try to plan early. We try to put these people on supplements, prenatals. We try to do blood testing for them, just to make sure everything is fine and try to correct what we can correct before they get pregnant. Because once you're pregnant, there are certain medications you won't be able to take.
Wow.
Right? So once a mother is pregnant, now that's a whole different story, because then we have to verify how far along they are. So we could calculate the date of delivery, so that we could determine if it's going to be a preterm or a baby that's unterm or post-term, which could happen after 40 weeks. Okay,
good. So I did I came and I asked and I developed my body. I made sure I'm taking everything. So I'm ready to I'm preparing for this baby, but I'm pregnant now. And so the excitement is here. What's the first thing I do?
The first thing you do when you realize you're pregnant is go into the clinic and get booked.
Okay.
We call booked the first or the initial date that you go in to see the midwife or the maternal child health staff, which are nurses who are trained to deal with booking parents, mothers, and get your doctor visit. So they would do your physical examination from your breast to checking, do a vaginal examination, to doing blood tests, to make sure we have a baseline of where you started. Good. Why? Because we know that throughout the pregnancy, the body changes, people could gain weight, but we also monitor things like sugar, because we do not want to have a diabetic mother that's not controlled, and because that could lead to complication. We have the blood pressure, which could become uncontrolled during the pregnancy, and that in itself could lead to further complications as well. So we try to establish baselines, blood levels, baseline blood sugar, baseline blood pressure, in order so that we do not run into complications further.
Right. So this first visit is crucial, like
very. And the earlier, the better.
I was about to ask, like, how long can I wait until it's like absolutely a terrible time to go in for my first visit? Like,
the earlier, the better. Why? Because at that point we get a quicker baseline, and we could do a longer follow-up with you and your baby.
right.
Typically, it is said that the fetal heart can be heard through a transvaginal ultrasound. So that's when you put an ultrasound inside the vagina, and they could actually see the fetal heart, how fast it is beating. So those are important things that you could see early on to make sure a baby is growing up, developing properly.
Right, and that baby will develop in certain stages. So maybe can you walk me through the stages of development and how, you know, my clinic visits would go along? What happens at each stage with me visiting?
So every time you go to the clinic, there will be urine tests done. Your blood test would be done every trimester. So not every time, but every trimester we try to get a blood test done. We ask for an ultrasound to be done as well. And this ultrasound is just to basically make sure everything is going along properly, try to see malformations. We could tell the sex at about 18 to 20 weeks. The sex can be determined, which I know a lot of people are excited for.
Yeah, but sometimes they say you get surprised because sometimes you think it's a...
because with the older technology, it wasn't 100% accurate.
Right.
Now, as things are moving along, we have 3D ultrasounds and all kind of thing where we could actually...
That our clinic that believes?
Not at our clinic, we could see it in private facilities.
Okay.
Which is another option. For mothers who are interested and excited. I know that there's nothing like the joy of having a child. So these people are super excited, and there should be.
Right. I just wanted to reach out to our viewers that, you know, if you have questions, if you're expecting, if you want to have a child, leave us your comments in the chats below, and Doc will be here to answer some of those questions or concerns, right? So as it relates to the stages that I go in, there's, I don't know all the fancy name. There's prenatal, there's antenatal, there's post, but like when it comes to I'm pregnant, I've done my first visit. What are the stages in which the baby develops and the complications associated with some of those stages?
So typically early on in pregnancy, one of the most common complications could be an ectopic pregnancy. So that is when the baby, it does not implant in the uterus.
So this is a very early stage. It's just the implantation stage.
Early. It could implant in the ovaries, in the fallopian tubes, and all of these could be life-threatening for the mom. That's early on. Another common one would be miscarriage. I know a lot of people have heard about it. A lot of people are aware of what miscarriage is. This is when you lose the fetus before 20 weeks.
Okay.
And there are many causes for it. One could be trauma, so you fall down, you could miscarry.
Right.
Intercourse that is not as gentle could lead to miscarrying. Lifting heavy weights, people with urinary tract infections, people with vaginal infections, all of these things put you at a risk of miscarrying. Also, a woman who has had a pelvic inflammatory disease or has had multiple deliveries, these people as well could miscarry easier.
Right. I think that's important for women to realize. You mentioned trauma, and that's basic in terms of taking care of yourself. You're pregnant, you can't just do the things you were doing before. Some women are moms already and they have jobs. And
well, we try to encourage people to live an active life, yes, but know your limitations, which is super important.
Right.
I think another thing to mention is having children back to back.
The spacing.
Spacing is super important. Your body needs time to recuperate. And when you have one child, and the child is 2 months, and then you get pregnant again, the body has not yet fully recuperated. And so that puts you at a risk of having a miscarriage as well. So these are all things that need to be considered.
Right. And so what are some of the things that are mentioned in terms of, I'm not sure, maybe you can speak on this topic, but those are some of the physical things, like what can I keep in mind in terms of like maybe the mental, the psychological component of preparing to have a child, and maybe some, you know?
I think it's different for everybody. I'm not a woman, will never experience that, thank God. For me, I'm fine with not experiencing it. But for a woman, I think it's family support is super important.
I'm glad you said that.
being with your partner, getting all that support, getting support from your church, from your co-workers. These are all important because stress can cause adverse effects, and we do not want that to happen. Also, know that for everybody experiences it different. There are some women who go into labor who are smiling,
Yeah.
and there are other women who go into labor and are with extreme pain.
Yeah.
Some women who have morning sickness throughout the pregnancy.
I
and some
wanted to
women
ask
who
about the
never,
symptoms. Yeah, like
some women who never ever experience any of these things. So for everybody, the experience is different. But if you are experiencing something that you think that could is discomforting for you, that does not cause comfort, that causes discomfort, then we would definitely recommend you going in and seeing your nurse, your practitioner, doctor, to be evaluated and see how best we could assist you throughout that process.
Right, that's great. I'm glad that you said that because everybody's threshold is different. So like you said, some people vomit, some people don't vomit, but you have to be the one to determine what's really uncomfortable for you, and you have to know when this pain is different. And right, so I think it's important that you know your body, that you're talking to somebody at the clinic, and that you're able to manage that, right?
Yeah, remember you're growing a human being.
Yeah.
So you're gaining weight, yes, on your extremities, but remember that your belly is also going out like this.
Yeah.
The uterus, when you look at the uterus, it's a small little organ, very small. So imagine that little organ getting huge. I mean, it is something to be considered, and it is a lot of work for women, and it is applaudable.
Right. I wanted to get to the part now where I don't think we mentioned it, but in terms of taking care of your body, there's a prenatal pills. Everybody has to take prenatal pills. I mean, I'm healthy as an Adventist person. I follow the health message. I exercise. I do all this stuff. Like, do I have to be on iron pills? Do I have to take prenatal pills?
So these prenatal pills provide other vitamins that are necessary and required for the growth of infants.
Okay.
And throughout pregnancy, women can develop anemia because of the whole pregnancy process. So it is recommended. These prenatals are recommended. I mean, if you want to take your other supplements on the side, continue to eat healthy, of course, this is super important as well. But do take your prenatals because it has been shown in countries where they do not take prenatals. It is not accessible to them because we give it for free through government. If it's not accessible for these people, then the children could be born with defects.
Yeah.
I mean, and that's not a risk I think any parent or any mother, anybody would want to run.
Right. So you take your prenatal pills.
Of course.
Right. At the point now you're preparing for delivery, what are some of the things that women need to come prepared for at the point of delivery? You know, you get to the hospital, you know, you have the packing thing, you have like, what should you expect? Not only in terms of challenges, you know, but like...
No, like what you should take.
What your experience, what you expect the experience will include.
If you're packing your bags, I think you should take comfortable clothes, comfortable shoes. Take everything that you think you need for the baby. So we do not encourage bottle feeding.
Right.
So that would not be recommended to take. But you could take your little blankets, their little hats, shoes, to be able to swaddle them, of course, which is super important. And I always mention for people to take their clinic cards. I always say that the clinic card is like your passport. If we've been following you up for all this long period of time, it's all there recorded.
The history is there, and that's important.
History is important because if we see something that's totally different from what we're seeing on the clinic card, then we know, okay, something is wrong. It's time to make a different action or approach it differently. Especially if it's a patient that I've never seen before, there has to be some type of recorded history so that I can follow up with these persons. So it's super important to take your clinic cards.
Yes, when you're packing as well, I'm thinking about like, how long should I pack for? You know, ladies always ask like, how long should this trip take?
Well, typically if you're at term, it is said that labor at term should last anywhere between 12 to 14 hours.
Okay.
Up to 20. But typically you'll be spending, after the baby is born, you'll be spending it overnight.
All right, so I pack for like 2-3 days.
If you want to be on the glamorous side, definitely.
You know, that anything goes wrong, right? Good. No, I mean, it's very simple things, but like, you know, for expectant mothers who might have no idea, like, these are some of the things I would want to know.
And so just be patient. I think we need to be patient and try to be as calm as possible.
Yeah.
It is, for first-time mothers, it could be a little bit frightening, nerve-wracking. And yes, the medical professionals might be busy with other cases.
I've heard some horror stories about,
there are
like
horror stories everywhere. Look,
they don't
You
give
just
you the
have to look.
attention you want, and
The thing about it is that public institutions are overwhelmed many
Yeah.
times, but we do the most with what we have.
right.
And when it comes to these maternal deliveries, we try to prioritize cases that are more complicated over those less complicated.
And
we try to do our best. Of course, human beings, we're not perfect, but we try to do our best and try to accomplish as much as we can.
you said maternal deliveries, and I want to address and confront this myth, because the idea is that doctors aren't even delivering babies anymore. All they want to do is cut you. Like, under what circumstances would you have to do a C-section?
All right, first, in Belize, in the hospitals, in the polyclinics or community hospitals, most of the time you'll meet a midwife who will do your delivery.
Okay.
At the public institutions. In the private hospitals, I'm not really sure how that runs. You will more likely have a specialist, but in the public hospitals, yes, we will have midwives. Doctors become involved when the case becomes a little bit complicated, or if the nurse is overwhelmed with other cases,
Right.
then you'll see doctors stepping in to assist with these cases as well. When it comes to C-sections, there are multiple criterias. I mean, something like a cephalopelvic disproportion, this is when the head
All
is
right.
too big
Okay.
pass through the pelvis. And so these cases definitely has to be cut.
Okay.
If we have a baby with a low heart rate,
All right.
has to be cut. We will not wait until a child dies. So, I mean, there are multiple different reasons for a C-section. And it's important for you to talk to your healthcare provider and try to establish what would be the best route for you. I know that there are mothers who want a C-section. You understand?
They don't want to do the actual.
They actually want to do the C-section, even if it's their first or second babies. I know sometimes it's done so that they could tie off them right away.
Are there different risks associated? Like, if I'm to choose having a natural birth versus a C-section, like, are there different advantages or disadvantages or risk associated with any one of them? Like,
It is a case-to-case basis, really.
Right,
It is a
okay.
case-to-case basis, and the reason for you wanting to have a C-section, but we do promote and encourage normal vaginal deliveries. Of course, not everybody will be able to do it, but for those who can, definitely, it is encouraged.
right, because one of the questions that people often ask is that they have to slit you and then it hurts and that's painful, and if I could, avoid that, I wouldn't want to do that.
See, sometimes when it comes to getting the episiotomy, which that slitting is called, the episiotomy is not done all the time. But when it's done, it's because they have tried as much as they could to try to get the head out and they can't.
Okay.
And so instead of you tearing traumatically, we inject lidocaine and then we cut. And after the baby comes out, then we sew it back up. And so the healing process is like everything else. I mean, it takes a while. Yes, it is hurt, but you run more risk in those cases not getting slit.
Yeah, and the
actually having
baby
it-
pressure from the child.
and just having it cut you or
yeah.
tear you inside. I mean, that is
Right.
very risky.
Right. You said injection, and this is a next question. I don't know if it's correct term. What's the injection they give you in the back to kind of like what do you call it? Stimulate the pregnancy. Like, is that some people are scared of that? Is there any reason to be scared of that?
Okay,
is
that
epidural?
injection you're mentioning in the back is an epidural, and that's so that they don't feel the pain.
Okay.
It does not necessarily stimulate the or have the baby come down quicker.
Good. That's a myth.
What we do for if we see a mother is taking long to dilate and stuff, we can give some oxytocin to help to dilate the cervix.
Okay.
Buscopan to relax the smooth muscle and for the baby to pass down easier and a little bit quicker, no? But it depends on everyone. It's a case-to-case basis, really. And like again, you have to speak to your healthcare provider and go into it knowing what the possible risks are and what the possibilities to resolve those risks are as well. So education is super important.
Yeah, I'm glad that you said that. Even though our time it seems like we just started talking, but I don't want us to leave without talking about postnatal care. I think we give a lot of attention to baby showers, the pregnancy process, and then when the baby is there, like you feel kind of neglected, like nobody tells you afterwards, or postnatal care is not as glamorized. So can you share a little bit on postnatal care, what that's like, the importance? And
it is a recovery period. It is a recovery process. It's not every day your cervix dilates 10 centimeters.
not every day.
And if anybody have a ruler at home, they could measure 10 centimeters. It is a lot. So you need, and you've been going 9 months with a human inside, so your body needs a time to recuperate and to go back. Immediately though, after the baby is born, of course we deliver the placenta. And once that is delivered, we try to do uterine massages, we give uterotonics, oxytocin to try to prevent bleeding.
Okay.
Try to do little sutures if you see any bleeding inside. And then we swab the mothers, trying to remove blood clots every 15 minutes. And then we monitor the baby and the mother for at least 24 hours before releasing them home.
Okay.
Of course, when they're released home, we send them to their clinics again. So you have to continue your follow-up at the clinics. The follow-up is not only for the baby to be vaccinated and for them to be registered in the clinic, but also for the mothers to be examined to see how they're doing. Is there any difficulty with breastfeeding? Do they have postpartum depression, which is something that we don't often speak about? And to see if they actually have the support needed to raise a child. If it's a first-time mother, it's very hard for them.
Wow.
And if it's a mother who has delivered 12 years ago and now is having a baby again, it's like the first time all over
Yeah,
again.
I could imagine, or more traumatic, because like this wasn't how it went the first time.
So mothers do need support from their family members, their partners, as well as asking the questions. Don't be afraid to ask the questions.
Right. Don't be afraid to ask a question, guys. I'm certainly learning a lot here, and I hope you are too. Doc, it's been such a privilege having you here. I'm not sure what I missed, but I know that our time has escaped us. So I just wanted to ask if you had any closing encouragement, for women who are pregnant. Maybe we address the women too much, and we don't even. Not the men who are pregnant, yes, but leave some tips.
Well.
Leave some tip for the men.
Definitely, be patient, be supportive, and that's the most you can do.
Be patient, be supportive.
And prepare yourself mentally if you're going in at the delivery room. Because we can't have you to faint, because that will be 3 patients, then the mother, the baby, and then you. So just try to prepare yourself mentally, be patient and supportive really. And of course, communicate with your partner and try to understand what she needs and what she's telling you that she wants.
Excellent. All right, we're gonna take a break, and when we come back, we want to hear a different perspective. We've heard from the clinical, from the hospital. We want to hear about the midwife, that home care perspective. Sometimes it seems like there's a competition between, should I get a midwife? Should I just have my baby at the hospital? And so we got the first perspective, and I thank you so much, Doc, for sharing that with us. And so when we come back, we'll talk a little bit about having delivery at home. Thank you for joining us on Defining Your Health. We'll be right back. Okay.
And ACS is fulfilling this mission by assisting families and communities through local initiatives such as disaster response, food and clothing distributions, elderly care, urban gardening, and self-sufficiency programs. So how can we help to help others? You can become an ACS volunteer or donor by contacting us at 610-2045 or emailing us at atn@cbm.belizeunion.org. Adventist Community Service, making a difference, helping humanity, providing hope for Belize and the world.
More than 32% of adults over the age of 20 suffer from high blood pressure, according to the Center for Disease Control. High blood pressure is a major risk factor for cardiovascular disease and mortality, as well as among the top causes for other chronic health conditions. Anger and frustration has been shown to raise the level of stress hormones in the body, triggering negative health effects such as high blood pressure. That's a fact, but there's hope. Those with hypertension have seen dramatic benefits from learning to forgive. In one study, those who scored high on anger tests no longer required blood pressure medication when participating in a forgiveness program. As someone said, you simply cannot swallow a poison pill and hope the other person dies. So forgive now and see your blood pressure going down.
Alessandra Alamia. I am in the class Standard 5 Choral at New Horizon SDA. Today I am going to be telling you what I like about my school. I like that there is supportive teachers in this school that always encourage their students. Like right now, I have a teacher named Mr. Javier Rodriguez. He's always supporting his students and telling them to do their best, as well as Ms. Talita.
Hi, my name is Elizabeth Sansores, and I am the Vice Principal of New Horizon SDA School. New Horizon SDA School was established in 1999 with the purpose of serving the community of San Pedro spiritually and academically. We started out with a population of 50 students and 5 teachers. Currently, we have a population of over 500 students, 18 teachers, 2 administrators, and a secretary. Our goal is to increase our classrooms so that we can serve an even bigger population. We look forward for your support.
Hi, my name is Samuel Che, and I'm the principal of New Horizon Seventh-day Adventist School. New Horizon joins the Sisterhood of Adventist schools around the world in preparing students for this life and the life to come. New Horizon takes pride in working on behalf of the social life of our students. We also do all our best to work and improve their physical life. And one of the important things we put a lot of effort is the academics. And for that, we do programs that will uplift them, that will make them stronger spiritually, and that will eventually take them to accept Jesus as their personal Savior.
Thanks for supporting
Adventist education.
Are you taking heart medicines? Medications can give us a false sense of security. Even if a person takes heart medicines, eating a lot of saturated or trans fats, fast and junk foods, red and processed meats, sweets, and processed foods will still increase inflammation and make cardiovascular disease worse. That's a fact. But there's hope. A study of more than 31,000 adults found that you can substantially reduce cardiovascular recurrence beyond drug therapy alone by eating a diet rich in vegetables, fruits, and fish, and low in meats. A heart-healthy diet reduced their risk of dying from cardiovascular disease by 35%, a new heart attack by 14%, heart failure by 28%, and stroke by 19%. So eat your veggies. A healthy heart starts with a healthy meal.
Hi, I'm Pastor Emiliano Viamel.
And I'm Elder Shane Neal.
And
we're the hosts of Hour of Power. We are ready to pray for you and with you.
Prayer is the key that unlocks heaven's door. In Philippians 4, 6, and 7, God cautions us not to be anxious about anything.
Instead, in every situation, by prayer and petition, with thanksgiving, present your requests to God. And the peace of God, which transcends all understanding, will guard your hearts and your minds in Christ Jesus.
Join us every Thursday night at 6 p.m. on our Facebook and YouTube pages, as well as Channel 98 on Central Cable TV, to experience this peace that passeth all understanding. You can join our global prayer family by praying that God continues to lead and bless this ministry.
By becoming a faithful viewer and inviting your friends and family to like and share our programs.
With your kind donations as well as your generous financial contributions.
Contact us at 501-613-9351
or send us an email at atn@cbm.belizeunion.org.
We are located at 10 3/4 miles Northern Highway at the Tubal Trade and Vocational Institute. Thank you for being a part of the ATN ministry.
And we pray God's richest blessings upon you and your family.
welcome back to Defining Your Health. This morning we're talking about health tips for labor and delivery. And as promised, we have a midwife on the scene. We heard from Dr. Canul and we want to get a different perspective. And so, start to introduce yourself.
Okay, my name is Audrey Budd, midwife of 38 years, living in Sand Hill, delivering over 5,000 babies in that time.
Wow, that's a lot. That's amazing, Miss Audrey, and I'm sure that we have that amount of births. You're familiar with her face, right? And so it's a privilege to have you here on ATN with us, and we wanted to talk about, you know, the idea, the whole preparation for having a child. So, how did you get into midwifery? Like,
okay, I had a passion for delivery. For some reason, there was an experience of a baby born on the ground and somebody needed to help. I was very young and I did that. And I said to myself, someone needs to do this in the village because the villages is so far away from the hospital and it's certain hours that sometimes you don't have a transportation. Somebody has needed to do that. So I saw a need for the village.
And this was from a very young age because you've been doing
At the age of 28.
Wow.
So then what I did, I started moving around these health facilities and around the clinic and around the hospital doing voluntary work. That's where I started. That's where I started.
And would you say that this is like a natural gift you had or something you learned to love, or like, what is the experience like for you?
When I first delivered some babies in the hospital, it brings joy.
Mm-hmm.
It brings joy to me. I felt good about it by helping someone. I was always that person to try to help someone. And then the doctor say, but you must have been doing this a long time. I said, no.
Well, you do a good job.
So then I think it's a gift because I wouldn't do it so long. I do other jobs, but I don't never do one job this long.
So that means this is your love, this is your passion.
Yes.
How do you get your clients? Like, how do even people, you know, get in contact with you and find out about the service you give? Like, I just had to ask, do you know a midwife? And the first thing they told me is Miss Audrey, and they gave me your number.
Okay. The training that I've been through to be certified comprise of the clinics, private places, and when you deliver a baby and they go back to the clinic and they hear, well, this baby was born at home and blah, blah, and she's so nice to me, somebody else will come along. So they share that, and some like it, and they come along. So when they do come along, then I would ask them, can I see the clinic card, since you already joined clinic? Right. And besides that, I am a health worker, voluntary, for 40 years. So then I see these people most of the time.
That's a lot of experience behind you. I would definitely trust that. So one of the first things that you do, I call you and I say, Miss Audrey, I'm pregnant and I'd like to utilize the service as a midwife. How do we take it from there?
I said to that person, you need to visit me.
Okay. So
one by one. And since you're joined clinic already, bring along your clinic card. And if you have an ultrasound, bring all this so I can see what is taking place.
Right. And when I visit, what happens?
So when you visit and I look at that, I give you a checkup.
Okay.
And then we start talking from there. You go back to the clinic, you visit once a month, and we talk different things so you can be comfortable that when the delivery, time for delivery, you are comfortable already.
Right. You know, like when you go to a clinic and so you go ever so often, like how often would I be able to visit you to get some feedback from you and for you to help me along and give me tips? Like how is that relationship like?
Okay, because of the pandemic, before the pandemic, people would come once a month.
Okay.
But with the pandemic, they give them a space of time to come to the clinic so they don't have the crowd, you know, and all this touch and touch. And then that would be a longer period of time, and because of that, I need to see the clinic card after they visit the clinic so I can see, update what is taking place.
Okay.
So it always have to be after the visitation.
Right.
And that will produce like a blood result and sugar result, so I can see more.
And you specialize particularly in home care, having the delivery at home. Like for most people, when you talk to them, like why do most people want to have their baby at home?
Okay, in the older years, these people from the villages were born at home. And they would give you their experience, what their mother said to them. Well, you know, this person delivered you, but he's dead now, and they kind of like, what? So there's nothing wrong. We love it like that. It makes it easier. We're at home, we feel comfortable, and somebody else comes to you.
Right. So that's when you plan it, and what if you have an emergency though? How do you respond to emergencies?
Okay, let's look at emergency. Emergency is not for me. But if there's an emergency, but prior to that emergency, I took an ambulance course so I can know where the emergency is.
Okay.
Because you can't refer somebody without an emergency. You just don't send them just for send them. Otherwise, might as well go there from the first place.
So
they can choose that.
I didn't get in contact with you before. I'm about to deliver. I'm on my way to the hospital, but I stop at Stanhill and ask me if a midwife is around, Miss Audrey. Like, how do you respond to that? Like, what happens in that case?
Okay. First thing I check to see if you're dilating.
Okay.
And if that's not happening, or if that is happening, let's use one that is happening. Oh, you have 4 centimeters. Let me see your clinic card. Oh, this is okay and that is okay. Then the delivery will go smooth.
Okay, what
But if there's another case,
yeah,
and I see a lot of bleeding, and I said hospital, you might say to me, well, I don't have transportation, then I call the ambulance, because that's an emergency.
Okay.
High blood pressure, position of baby, breech baby, bleeding, that goes to the hospital.
Right.
So we have 2 deliveries, a home delivery and a hospital delivery. All can go to the hospital. But the villagers, most of them choose to have the baby at home.
At home. Can you paint the picture for me? Like, if I have the baby at home, like, what do I need to do to prepare for you to come to at home? Like, do I have to have towels out? Do I have to have water here? Do I, like, where do I sit? I stand?
No,
like
I have this, not you.
Walk me through what happens when I'm at home for the delivery. Like,
okay, okay.
I'm in the chair. I'm lying down. Like,
no, okay. First I check you. If you start dilating, I say you're in labor, so I will keep you. For some, you would have pains, not dilating, there's other problems, and then I refer you.
Okay. So most of them happen, most of the deliveries that you do at home, they happen in your personal room, in your bed?
We have a delivery room, special for that.
And how is that set up? Like, is it different from the setup at the hospital?
Everything is in one room. You know, you don't have a room here and then you go to the delivery room.
Yeah, like it's more comfortable?
Well, most of them say it's comfortable.
Okay. And so have you...
I have everything set there. It's on a table. They can put their bags where. There's a bed, there's a good light, and you have your tools already clean.
Okay, good.
You're preparing, because when you have a patient, you know, okay, I have 4 for June and I have 10 for July. Then you're preparing, so you keep this clean.
All right.
And then you clean them while they're there.
Okay. So,
and have it covered.
All right. So how is the experience different from in the hospital? Because I know you might have to have a C-section at the hospital, but you don't do that for home. Like, so how do you, like, what are some of the challenges that you might have in terms of setting the womb or different things like that when it's time for
Okay, the job that I actually do at home would be advising them. It would be like some should have prepared ahead, but because they did not prepare, we can still work things along the way. We talk about labor and delivery, so it's not new to them when it's happening, so they feel comfortable. We would look at their card and be honest with them. We need to clear up this and this and this and this. Maybe you want me to elaborate on it?
Yeah.
Okay. So then if I have a card and it's saying high blood pressure, then I say at the end of the pregnancy, so they start drinking more water, less fatty food, cook with very little salt. And let's see the next visit what the blood pressure would say here. So that's why you always have to accompany your card. Because anything can go fluctuate.
So it's for you. One of the things I keep getting is that you're very responsible as a midwife in terms of making sure that their cards are up to date, that you have the information you need to advise properly and be of service to them the way they need it, right? I know that sometimes when you have a midwife, they help in different areas, like you might get prenatal pills at the clinic, but you also assist like with cleaning, like how do you prepare yourself as a woman for the child?
Okay,
like,
for those that have not been prepared, I would remind them when you need to get another baby, you need to be prepared. And there's 5 things. Take a clean out, put up the womb, you close the back, take some prenatal. That when you get pregnant, you're already above things. So then it's not likely for you to fall into emergency.
And then you recommend the prenatal pills as well, so to help the
yes,
mother?
But when they attend the clinic, they work with that. They take it from there because they provide that for them, and it's free of cost.
Have you ever had any challenges that you overcame, like with one of your clients? Like maybe you had to fix something, or you had to help them in a way that they had a complication and you were able to assist in any of your experiences delivering babies? I'm sure you met challenges. Can you share any?
Yes, you met challenges. But like I say, emergencies for the hospital, but you can do something meanwhile waiting. So some of the challenges I find at home, they would ask questions like, when is baby going to be born? They're watching the time, they're watching the date, they're watching different things, which doesn't make much of a sense. Because it's not all the babies that are born the date that they give you.
Right.
So I would say to that person, listen, clinic give you a date. Ultrasound give you a date. The private doctor give you a date, and the midwife give you a date. It's not about the date. Prepare 2 weeks before, and you wait for the pain. Then that doesn't put hair. You don't keep it there.
And speaking about pain, when they consult you with different types of pain, I'm sure you're able to identify that sometimes the cause of the pain is not natural and it's due to maybe infections or something else like that. So how do you
okay.
consult?
I look at the clinic card. So I see the due date is far away. So that's one of the things. Sometimes they would say, well, I vomit a lot, I don't eat much. When I check the stomach, there's the gas. So then that pain comes from gas. So I need to prepare some little herbs to help you with the gas. So that's the advice I give them, to take something before you eat to break the gas, so that will help you. So that's one way. And then when I look at the card and they have not been treated for infection, I would say, when are you going to the clinic? Oh, next 2 weeks. This cannot be wait. So, and this is for everybody. If it's a Monday and there's a clinic present, you can go and tell them what is happening than to wait for 2 weeks until something happens like a miscarriage. So those are the advice.
Okay, and you mentioned miscarriage just now, and I know that that's not a nice experience for mothers. Is there anything that you recommend they can do to prevent that, just so that they have that healthy child?
Okay, let me mention a few. Sometimes they have the babies too close, so the body needs to be healed at least 2 years. Then most of them are not prepared for the pregnancy. It just comes and meets whatever it meets. So sometimes it's high blood pressure, diabetes, it meets all these things. So then it's best to prepare before. If you know you want a baby, do the necessary preparation. Like they clean out and they put up the womb and they close the back and this kind of thing.
All right, good. I just want to, I want you to share, because for you, you've delivered a number of babies, like you said, thousands of
And
babies.
I love what I'm doing.
And you love what you do. Like, what is it like, every time that you deliver a child? What's that feeling like?
It not only feels good, but for me, I see myself, I wanted 12 babies. I only have 2, so listen to this. All these babies are mine, and everywhere I turn, I see these babies.
Yeah, man.
Like today.
You can see them grown up and, alive and well, and you know that you played a part in that miracle, that tiny miracle.
Like right now, I feel good on the village. Some of the babies, they're policemen and women, chairman, nurses. This is what I see. Teachers. I always feel like they're mine.
Right. And so, we're winding down, Miss Audrey. Like, what what would you say, to support that the role of people saying, you don't need midwives anymore? Like, how would you encourage others, to still utilize the service of a midwife, or why is it important, to still have access to
Okay, I need to clear up something, because if someone say, you don't need to go to a midwife, well, those that deliver babies in the hospital, they are midwives, but they are trained. In the older days, they weren't trained, so maybe that's the difference. So they figure you don't know what you're doing, or if an emergency, you don't know what to do. For me, in this case, I have them come to my home that I can get access to transportation or any emergency transportation to the hospital, then go all the way Flowers Bank. That's just an example.
I think that's important to know, that all the midwives are trained, but you specifically are trained to deliver at home, because the same people that assist you at the hospital are also midwives.
Exactly.
Right.
Exactly. So I want to clear that, because most people say, well, don't go to the midwife, but it's not the midwife is the problem, because the midwife is trained. I would not want to practice on somebody else. I deliver my own daughter, baby, and my sister's children, and my church friends, and I feel good.
So you have that more personal touch. So we want to thank you.
And they don't not only have the baby and just leave.
Yeah.
We keep in contact as we meet.
Amen. Amen. So you continue with that relationship afterwards. So I want to thank you for joining us on Defining Your Health. This has been a great episode. I've learned a lot. I got both perspective, and I know that you add that personal touch with all the clients that you meet. And so I want to thank you, our viewers, for sharing with us this morning. And Miss Audrey, it was a blessing to have you, and I hope that in some near future we'll be able to have a conversation.
All right.
Thank you for joining us for Defining Your Health. We'll see you again next week at 10 a.m.
Bye.
Thank you for your prayers and support of the ATN ministry, and together we may hasten the soon coming of our Lord Jesus Christ.